It is the beginning of a remarkable week for people facing various health challenges, as the Akwa Ibom State government has, through this outreach, written off their medical bills. A further push in Governor Umo Eno's commitment to deepening his administration's social reach, in line with the healthcare pillar of the Arise agenda. The free medical outreach at day one already saw over 1,000 patients. Describing the huge turnout as indicative of the magnitude of healthcare needs among vulnerable and the underserved demographic, the Commissioner for Health, Prof Augustine Umoh, said plans by government to float a health insurance scheme is underway. Commenting on the outreach, Professor Umoh, while applauding Governor Eno's magnanimity, charged people of the district to take advantage of the intervention while showing support for the administration.
I think it has become very obvious to every discerning person by now that His Excellency Pastor Umoh Eno, the Governor of Akwa Ibom State, is one that reacts very positively to the challenges of the people of the state. You could see with what happened in the earlier outreach we had in Uyo. This serves to, as a form of palliative also for the people. In a more long term, we are planning on something that will be more consistent, something that will be more sustainable, and that is a medical health insurance scheme. We are working quietly on this, and in the very near future, you will get to see what is done in this area. That will help patients, particularly starting with the vulnerables, and whom we also have on the social register, who will come out to register. It will help them to be able at least to get help to some level. So this will help. Both we have the fee paying in the hospital, we have these temporary interventions, and then we have the more sustainable intervention in that regard.
The Chief Medical Director, Ikot Ekpene General Hospital, Dr. Nene Francis, and Program Manager, State Action Committee on AIDS, Dr. Enobong Akpan, lauded Governor Umo Eno's commitment to health care.
What we have right now, it's not because the sickness is, the incident has increased. We have lots of them coming because of the low socioeconomic status. They've not been able to afford treatment for some time. Most of them here were already diagnosed with these diseases, but they were unable to be treated because they don't have funds, which I think the state health insurance scheme that is coming up will help a lot to help the people that can't afford to pay at pay points.
One of the things that has happened in our state is that in the past few months there have been a lot of such outreaches, such that has never been before now. And these outreaches have been channeled towards the people in the rural communities. And I must say that our governor is walking the talk in terms of rural development. And you know that one of the key indicators of life is health. And our governor is very, very particular about the health of our people, especially the people in the rural communities. That's why these outreaches are geared towards meeting those that otherwise wouldn't have had access to medical services. And
apart from clinical consultations, laboratory examinations, and optometric services, the outreach on the first day had already commenced surgical services.